Oscimin Sl Tablet, sublingual, is used to treat a variety of stomach and intestinal problems such as cramps and irritable bowel syndrome. It can also help with bladder and bowel control issues, cramping pain caused by kidney stones and gallstones, and symptoms of Parkinson's disease. Additionally, it can decrease the side effects of certain medications and insecticides. This medication works by decreasing acid production in the stomach, slowing down the natural movements of the gut, and relaxing muscles in many organs, such as the stomach, intestines, bladder, kidney, and gallbladder. It also lessens the amount of certain body fluids, like saliva and sweat. This medication belongs to a class of drugs known as anticholinergics/antispasmodics. The recommended daily dosage and the optimal timing for taking Oscimin Sl Tablet, sublingual, should be determined by a healthcare professional based on an individual-specific condition. To take Oscimin Sl Tablet, sublingual, simply place it under your tongue and let it dissolve. You can also swallow it whole or chew it. This medication can be taken with or without food, as directed by your doctor. The dosage of Oscimin Sl is determined by your medical condition and how you respond to treatment. It's important not to increase your dose or take it more frequently than prescribed without consulting your doctor. For adults and children 12 years and older, the recommended maximum daily dose is 1.5 mg. Children aged 2 to 12 years should not take more than 0.75 mg in 24 hours. If you have any questions about the dosage, be sure to ask your doctor or pharmacist for more information. It's worth noting that antacids can affect how your body absorbs hyoscyamine, the active ingredient in Oscimin Sl. If you take antacids, it's best to take them after meals and take hyoscyamine before meals, or wait at least 1 hour after taking hyoscyamine before taking antacids. While taking Oscimin Sl, make sure to drink plenty of fluids unless your doctor tells you otherwise. And if your condition persists or worsens, be sure to inform your doctor. Some common side effects of Oscimin Sl Tablet, sublingual, may include dizziness, drowsiness, blurred vision, dry mouth, headache, trouble sleeping, constipation, flushing, dry skin, and decreased sweating. If any of these effects persist or worsen, it is important to inform your doctor or pharmacist promptly. To relieve dry mouth, you can suck on sugarless hard candy or ice chips, chew sugarless gum, drink water, or use a saliva substitute. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people who use this medication do not experience serious side effects. However, if you experience any serious side effects such as mental/mood changes, fast/irregular heartbeat, difficulty urinating, decreased sexual ability, loss of coordination, trouble speaking, or vomiting, it is crucial to inform your doctor immediately. In the case of very serious side effects such as eye pain/swelling/redness or vision changes, seek medical help immediately. While a serious allergic reaction to this drug is rare, if you notice any symptoms of a serious allergic reaction like rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. If you are in Canada, you can call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Before taking Oscimin Sl Tablet, sublingual, make sure to inform your doctor or pharmacist if you have any allergies to hyoscyamine, atropine, or any other allergies. Also, discuss any medical history of glaucoma, enlarged prostate, urinary blockage problems, stomach/intestinal issues, overactive thyroid, heart problems, high blood pressure, kidney disease, heartburn problems, nervous system problems, or myasthenia gravis. If you wear contact lenses, you may need to use wetting eye drops as this medication can cause dry eyes. Be cautious as this drug can make you dizzy or drowsy, or blur your vision. Alcohol or marijuana can intensify these effects, so avoid driving or using machinery until you can do so safely. Also, be aware that this drug can increase the risk for heatstroke. Avoid becoming overheated in hot weather, saunas, and during exercise. For older adults, there may be an increased sensitivity to side effects such as confusion, drowsiness, excitement, constipation, and difficulty urinating. Children may also be more sensitive to the side effects. During pregnancy, discuss the risks and benefits of using Oscimin Sl Tablet, sublingual with your doctor. It is also important to consult your doctor before using this medication while breastfeeding. It's important to be aware of any potential interactions with other medications or substances. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Some products that may interact with Oscimin Sl Tablet, sublingual include certain azole antifungal drugs, bisphosphonate drugs, corticosteroids, digoxin, potassium tablets/capsules, and pramlintide. Also, be sure to inform your doctor or pharmacist if you are taking other products that cause drowsiness such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or antihistamines. Check the labels on all your medicines, including allergy or cough and cold products, as they may contain ingredients that cause drowsiness. Additionally, Oscimin Sl Tablet, sublingual may interfere with certain lab tests, so it's important to let lab personnel and all your doctors know that you are taking this medication. As always, it's best to consult with your healthcare provider before starting, stopping, or changing the dosage of any medicines. If you or someone you know has taken too much Oscimin Sl Tablet and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek emergency medical help by calling 911. You can also contact a poison control center for further assistance. Symptoms of an overdose may include hot and dry skin, fever, unusual excitement, fast or irregular heartbeat, and seizures. It's crucial to seek immediate help in case of an overdose. Now, let's talk about the uses of Oscimin Sl Tablet, sublingual. It is used for the management of digestive disorders. This may include lifestyle changes such as stress reduction programs, exercise, stopping smoking, and dietary changes to increase the effectiveness of this medicine. It's important to talk to your doctor or pharmacist about lifestyle changes that might benefit you. Remember not to share this medication with others. And when it comes to the optimal timing for taking this medication, it's best to follow the dosage instructions provided by your healthcare provider. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Take your next dose at the regular time. Don't take a double dose to make up for the missed one. When it comes to taking Oscimin Sl Tablet, sublingual, it's important to store it at room temperature away from light and moisture. Make sure to keep it out of the bathroom and away from the reach of children and pets. When you no longer need this medication or it has expired, it's important to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do so. It's also important not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.